Hello everybody, I'm Wendy. I'm Service Manager for Community Nurses in Daventry and South Northants. So we're here to tell you about the community pathway. So within community nursing, as in a lot of nursing professions, there is a shortfall of nurses. We were struggling to recruit into nursing. Whether we recruited nurses who've been qualified for a while or newly qualified, which we didn't do a while ago, it was becoming very hard to keep them in the profession. As a community nurse, you don't just learn one aspect of looking after a patient, you have to learn lots of different things. So you have to know a bit about medicine, a bit about surgery, wounds, end of life care. So for these nurses that were coming out to us, they were finding it a massive challenge to have to suddenly learn all these skills within a very short space of time. So a lot of them were falling down by the wayside, they were feeling very disillusioned and unsupported. So what we thought we'd do with Lisa from the university as well is we'd actually flip it slightly on its head and look at how we could look at these nurses coming into our profession and giving them the training to enable them to hit the ground running straight away. So these three ladies here are part of our guinea pigs that have done the first pilot for us. So we approached them with Lisa on the end of their second year, beginning of third year, to ask them if they wanted to be part of the community pathway. So as for this, what they do is they come into the community and they're scoped out to different areas that NHFT have to offer. So that would be community nursing, intermediate care, inpatient beds and hospices for end-of-life care. So their third year is around all of that. They will go and visit heart failure nurses as well and diabetes, so that they will learn everything that the patient would have to do within the community and what services they would need. These three ladies have progressed along this course. They've all enjoyed their experience with us and have been successful in getting jobs within community nursing. So as part of their final placement, what they've done is they've been aligned with the team that they're going to work with, where they have a job with. So for their final placement, they've been given the training, the encouragement, the support, so that when they actually qualify and have that big scary day where they put their blue dress on, they've actually got the skills behind them. They're already autonomous practitioners. They've had the support, so it's not so scary for them. So this has been a very good progress and process for them to learn, and hopefully it will carry on for the next lot. So I'll pass you on to Lisa now.
Hello, I'm Lisa. I work in the pre-registration team with the professional practice education and training team. My remit is around pre-registration nursing and supporting the placement opportunities for student nurses and working with the university and the operational teams. Now this all came about because the mentors who were supporting the students pre-registration in practice were telling us what fabulous students they were having, and these students need to come and work for us. The students themselves are saying what fantastic experiences I'd had and I want to come and work for you. And listening to Wendy and her colleagues with the challenges they were having at operational level in terms of recruitment, it just made sense to get everyone in the room and a forum for that discussion, and that's how this came about. We had to have the university support because the pre-registration programme is validated by the NMC, so we have to make sure that that's happening and that we're following that through to registration. But actually it's been very successful. We have come across some challenges as we expected. We just didn't really know what they were until we got involved, and they're mainly around our organisational internal processes. Things like students are not on the ESR, so how do we get them into training? Equipment, we've got the money, but how do we get through the purchasing? Things like a phone, how do we get that aligned to a non-member of staff at that point? So these brick walls, we've climbed over them, we've climbed round them, we've worked with other teams, and other teams have gone the extra mile to support this pilot. To see if we can do things differently. There were 13 students initially on the pathway. We lost 4 because they decided community wasn't for them, and that's a good thing because they knew early on that that's not what they wanted.
So by the end of my second year, I knew that I wanted to go into community nursing. I'd had an amazing experience with the community nurses in Daventry, and I knew that's where I wanted to go. So when we were approached by Lisa and her team, possibility of going along a community pathway, I almost bit her hand off. We've had struggles along the way, but we've managed to rotate throughout the services and have a real good overview of what NHFT has to offer. And then in our final placement, which we're nearly finished now, we've been aligned with the teams that we've been recruited into. So we've been able to get training experience in venipuncture, catheter care, syringe driver and end-of-life care. So we're already practicing those skills, already becoming competent, and that's then going to set us up for when we do get our pins later in the year.
It's been a really exciting final year on the pathway. It's given us a real sense of direction. We're able to sort of lead and manage our own learning and work with other services and teams, throughout community nursing. So it gives us a good idea of what else is out there, and it's given us a lot of confidence for when we make our transition to a nurse.
It's been, all three of us can agree, it's been probably one of the most beneficial things for our third year. Everyone's scared to come into their third year. I've got my dissertation, I've got this, etc. We've been really supported well by NHFT, Lisa, the university. However, we've came across different problems and barriers. Like Lisa said, we had issues with mentors not understanding what this pilot was, what the pathway meant. How do we do this? How do we do that? However, we've overcome across that, and I think it'll be beneficial for future students who do want to come in the community in the further years, and I think it will help them grow as into qualification.